My name's Kenny Villa. I'm here with the health department, obviously. I'll be kind of facilitating today too. So we're going to go around the room and have different people speak about what we're doing today, this joint statement we've released, and talk about that a little bit. And then afterwards, there will be a little bit of time for questions and answers. So you can raise your hands. I'll try to get to everybody, but to get all these people together in one place, it's a pretty tight window. So I don't know how many questions we'll be able to take, but we'll do our best. So appreciate you all again for joining us on short notice, but we have some important news we wanted to share and wanted everybody to be a part of it. So with that, I'm going to turn this over first to, well, let me introduce everyone we have on the call who's going to be speaking. We have obviously Dr. Anthony Chen with Tacoma Pierce County Health Department is here. He's going to be talking. Then we have Kent Hojum, CEO, Washington State Fair, here as well to talk for the fair. Executive Bruce Dammeyer's joined us as well. And Puyallup Mayor Julie Doors here. And then the fire chief from Central Pierce Fire and Rescue, Dan Olson, is with us as well. So we'll kind of go in that order. We'll, everyone will get a chance to talk again, and then we'll open it up to some questions. So with that, we'll turn it over to Dr. Chen first to talk about what we've done at the health department today and what we're looking forward to this next few weeks.
Great, thank you, Kenny. Thank you everyone for being here. Thank you also to our guests and partners, Kent Hogan from the Washington State Fair, Executive Bruce Dammeyer, Puyallup Mayor Julie Dorr, as well as Central Pierce Fire and Rescue Fire Chief Dan Olson. This has really been an effort for the Washington State Fair and the agencies that respond to the health and safety needs of Pierce County residents to join together to ask our fair guests to take additional steps to prevent and lessen the spread of COVID-19. As Kenny mentioned, you can read more in our news release. The fair is, I think you all know, is an incredible event here in our community. It is a 3-week event over 4 weekends. It draws hundreds of thousands of visitors. In a normal year, might be 1 million visitors. We love the fair. It is part of our culture here in Western Washington. Many of us look forward to it every year. And certainly I remember when my son was little, it was something which all the kids look forward to. But this year, unfortunately, we know that the cases of COVID-19 are really at unprecedented levels. At the same time, we are concerned that we can get surges of cases after large events. And as a community, we have to reduce the load, not only on the residents of our community, but on our hospital systems. And our local hospitals have a mission to serve Pierce County and provide life-saving care to anyone in need. And right now, I think as you've seen in the news, our local health systems, our local hospitals are under tremendous strain. It's not only in terms of how full they are, but the physical, emotional toll on healthcare workers is significant. They are doing amazing work, but they are tired after 19 months of dealing with this pandemic. So we have to think of those workers as well as the non-COVID patients who need care. The number of patients is placing extreme stress on our healthcare systems. Hospitals are doing everything they can to continue to provide care for every patient. Hospitals are stretching and extending staff and using every bed and space available. In fact, they're using space that they normally don't use for patient care. Area intensive care units are full, and because hospital beds are full, people may have to wait longer in emergency departments. Ambulances may experience delays. Hospitals are regularly over 100% capacity. And we know that this is not a good situation. Personally, I know that my mother, a couple years ago, back when we were very concerned about flu, but she had to go to the hospital during flu season, and they were so packed that, the waiting room was packed, the hallways were packed with people that they were kind of working on. And because of how crazy things were missed, and she had some bad outcomes. And we know that we run the risk that when we pack our hospitals and emergency rooms so full that care is not optimal, And so that's part of the equation that we're looking at. These have been challenging conversations because we know there are multiple perspectives to this, and I'm sure that the fair will talk about and the executive will talk about how this is, the fair is such an important economic and cultural and so many other aspects of our community. But we are working here together so that we can try to mitigate the impacts. And in terms of the fair mitigation efforts, I do want to say the fair, we've worked with the fair for a very long time, and every year during normal years, we're working with them, and they're always very easy and very good to work with. And so appreciate, the conversations with the fair. They're going to be doing some pretty unprecedented things as well. So they will be testing employees for COVID-19 before and during the fair. They're going to be offering testing for members of the public. They'll be offering COVID-19 vaccine daily when they're open at 2 different locations at the fair. They've reduced the number of rides, they've reduced the number of vendors, many other things which I'm sure they will speak about. And so we are very pleased to have such a good partner in them. But, we are taking this additional step to announce that we're going to be requiring all attendees of the fair to wear masks. And this really is in the context of where our cases are. We are at unprecedented levels of cases in our county as well as throughout the nation. And we're going to be keeping a very close eye on this. And, there are some criteria we'll be looking at where, if necessary, we may take additional steps up to, asking the fair to close. But with that, I'm going to pause. And Kenny, do you want me to?
Yep.
I think we should just go to the next person and then take questions later.
Yep, we'll take questions all at the end. Thank you, sir. Appreciate that, Dr. Chen. And Kent Hojum, CEO, Washington State Fair. It's all you, sir.
Thank you very much, Kenny. Thanks everybody for being here this afternoon. At the fair, we want to provide the safest possible environment for our guests. The health department, who are, by the way, great partners, and we appreciate all of the time and effort they've put into this. But the health department believes that this health order will help us to achieve the goal of providing the safest possible environment for our guests. And we will do our part to comply with that health order. Dr. Chen referenced a number of the other things that we're doing, and I'll just briefly cover those, but we've reduced the number of booths to create increased space in the commercial buildings. We've reduced the number of rides to create increased space in the carnival area. We've added dozens more hand wash stations and hand sanitizing stations to the over 300 that we already have on site. We will have 2 vaccination stations on site that will offer 2 return gate admissions for anyone receiving a vaccination at the fair. We will be testing employees. Testing will be available to the public. We'll be providing complimentary masks to those who don't bring theirs. And we're working on providing an enhanced medical services area for non-COVID related issues such as minor accidents, in order to reduce the number of transports to the hospital from the fair. And that's just a brief overview of the many additional safety measures we're taking this year. I appreciated Dr. Chen's comments about the fair. The fair's a 120-year-old tradition that really is part of the fabric of our community. Case could be made about the economic importance of holding the fair, but that's the thing about the fair. It's so much more than an economic engine. It's a cultural touch point, a chance to show your skills, sometimes a chance to compete, sometimes it's a chance to boast. It's all those things. But it's also a bolster to 2 of the 3 legs that make up the 3-legged stool that's part of societal health. And those 2 things are the economic health and the general mental well-being of our society. And we take those roles very seriously. And so once again, thank you, Dr. Chen, for everything your department has done. in moving this forward. Kenny?
Yeah, thank you, sir. Appreciate those words. Executive Dan Meyer.
Thank you, Kenny. From my perspective, we face some really important issues here. We had to make sure that our community is as safe as possible from COVID. We need to protect the capacity of our hospitals, but at the same time, we need to remember the value and importance of kind of things like the Washington State Fair and the role that it plays in many lives in our community, and the fact that going down there, even in the face of a challenging time like we're facing right now, that can be an important sense of connection to your past and hope for your future, not let alone all of the economic impacts. It is the livelihood of so many people here in our community. I will tell you, in Pierce County, we have a culture of getting people together around really thorny and challenging problems and coming together to work toward a solution. We call it the Pierce County way. And this example today is exactly what typifies when we talk about the Pierce County way. We had 4 very important goals that we needed to achieve with our work. The first was to enable the fair to be open to anybody who chooses to go to it. The second was to reduce the potential for COVID exposure. The third was to increase vaccinations in Pierce County. And the final one was to reduce the potential for impact on Good Samaritan Hospital's emergency room and our local hospital districts. Well, I can tell you the work that's been done by everybody on this call, all the agencies represented, I think we absolutely delivered on those goals. And I'm very proud of how it was done and what we're doing to allow the people of Pierce County to attend the fair if they choose in the safest possible way. So thank you very much.
Thank you, sir. Appreciate that. And with that, we'll go to Mayor Julie Dorr, Puyallup.
Thank you. I appreciate the city of Puyallup and myself. We appreciate the concerns raised by our hospital and health department partners on Friday. These are challenging times, and the recent surge in COVID cases because of the Delta variant is quite alarming. Recognizing the balance of our psychological, social, cultural, and economic benefits from the Washington State Fair, along with those of our healthcare community, is a challenge. But after hearing from the healthcare providers on Friday, our community partners came together and began to tackle some really tough issues. At work, I know that this issue was worked on pretty much 24/7 throughout the weekend and yesterday. The fair has they spent months planning for this event, and they were already implementing protective measures above and beyond what was asked of them. And after these discussions have gone even further, and they are taking safety precautions that are above and beyond anybody else in this state. So I want to applaud them for being good community partners and taking in the feedback of our healthcare partners and taking their role as a community leader very seriously, and they took very good steps to mitigate risk. In challenging times, I'm really impressed and appreciative of the efforts that were put into the health and welfare of this community. And I want to thank Dr. Chen and his staff, Executive Dan Meyer and the Pierce County DEM, the Washington State Fair, Central Pierce Fire and Rescue for jumping in when needed. And for me, definitely Puyallup Department of Emergency Management Director Kirsten Hoffman, who has been by my side through the last 4 or 5 days in this process. They came together and they found a reasonable balance to this challenge. And the fair is a place where this community comes to celebrate. They come to compete in competitions and show their prize, produce or it's just a place, it's just a community tradition that our community values more than I can articulate. And so the city of Puyallup stands ready to pivot should there be an issue that we need to help maintain the precautions and safety measures at the fair. And we're asking that our public does that as well. And we want this to, there's a lot of work going into making sure that we balance these, all of these factors. We are asking you to please comply with Dr. Chen's orders. These are challenging times, and we realize that not everybody is going to like those orders, but this is what we need to do to keep our community safe. And in times like this, where we don't often find a balance, I'm really proud of the balance that that we all came together and that we were able to find a way to respect everybody's concerns. And I think that we've got the best plan possible. So I applaud everybody and all your staffs for working on this. So thank you.
Thank you, Mayor. Appreciate that. We do have Fire Chief Dan Olson here. You want to speak, sir?
Yes, thank you. Really, I'd want to say just a few quick items. The first is the fair is going to run this year, and I can't tell you how good that is for so many people. I grew up, and my family came to the fair every year, and when I had children, I brought them to the fair every year. And you know the reason why? The smile on their face, the joy that was in their hearts, and then how tired they were and how they fell asleep on the drive home. It is a fantastic experience. It is friendly, it is fun, and it is safe this year. We have challenges because of COVID. We have a great health department, great leadership politically with Executive Dan Meyer and Mayor Dorr, and the fair's approach to really looking honestly and openly about the challenges. And so they put some structural elements into place to make it safe for everybody. And as your fire chief, I cannot stress how important it is, because safety rules are something that the fire department often deals with, maybe not with infection control, but with other issues. But in the end, every safety rule really depends upon you, every individual coming in and saying, you know what, we're going to fund it today. We're going to enjoy this as a family, but we are going to follow these rules because we want to see this happen again. And we want to have a good time, and we want to see everybody walk home safe. Lastly, I would just say that from a safety perspective, for an injury or accident at the fair, Central Pierce Fire and Rescue is fully ready, trained. The fair and Central Pierce have had a long-standing tradition of operating together, to responding to emergencies that come up. And they have actually added another resource to make sure that our hospitals are not overwhelmed. But I want to assure you, if something happens at that fair and you're having a medical emergency, we will provide the best care at the fair, and we will get you to a hospital for that definitive care rapidly. There is no fear for you to not, there's nothing you should be fearing in coming to the fair. I guess the last word is, please come. You're going to have a great time this year.
Thank you, Chief. Appreciate that. And with that, I think we'll open it up to questions. Again, we're doing this virtually, so if you can raise your hands with the button, or give me a heads up in the chat. We do have these folks just for a limited time here, probably for another 10 minutes till about 1:30, to answer a few questions. And I see it looks like Jessamine from Q13 first, and then Graham Johnson.
Thank you all so much for your time. I do appreciate it quite a bit, and the safety measures that you put in place. I'm wondering how you plan to institute any, I guess, any perpetrators how are you going to deal with them if you find people not wearing their masks? Are you going to be able to track them? Are you going to have a 3 strikes and you're out situation? How do you plan on monitoring people who might break the rules, and how will you deal with them?
Thank you for that question. That's a very good question. You know, this issue is without question a definite hot button. We have 10 roaming teams of security personnel, and they'll be inside and outside the buildings, moving around the grounds. If they find someone who doesn't have their mask on, they will ask them to please put a mask on. We've got hundreds of thousands of masks available. If someone's forgotten their mask, we will certainly provide one complimentary for them to use. We will have signage all over the grounds, at the gates, at the buildings, even some freestanding signs in just the grounds in general. So we will approach folks not wearing their masks. We'll ask to wear them, to put them on rather. We will be proactive at the gates to make sure everybody coming in has their mask on. And we'll try to do it in a non-confrontational manner, but we take this health order very seriously.
Thank you, Kent. Appreciate that answer. And Jessamine for the question. Jennifer, I see you. We have Graham Johnson next, though, and then Drew, and then Keith.
Thank you. A question for Dr. Chen. As you know, the state's hospital association has said holding fairs is a bad idea. Under what circumstances would you cancel the fair? Why are you not canceling it now?
So we've identified criteria of what we would be looking at as we monitor the situation. So the first is, as you alluded to, the hospital capacity throughout the state is very stretched. And so we will be looking at, it's called the Northwest Healthcare Response Network. They do a survey of hospitals. We'll be looking at hospitals that are reporting crisis status in Pierce County, as well as their rate of hospitalization in Pierce County. Now, I recognize that, as I mentioned earlier, they do have staffing issues, so we're probably going to be trying to look at staffed beds rather than licensed beds. The second area that, or second criterion that we're going to look at is, as you heard, the fair will be testing fair staff. So we're going to be looking at what is the rate of positive tests among fair staff. We anticipate there will be some positives, just as there are in, anytime you screen a large number of people who've been on the community. But what the objective here is for us to be looking at trying to prevent staff from coming to work and possibly exposing customers or, attendees of the fair. The last criterion we'll be looking at we'll be looking for outbreaks. So, are there outbreaks that are connected to fair staff, or are there outbreaks of individuals who are attending the fair? So, we are committed to the health and safety of all people who live, work, and visit Pierce County. And we know it's called the state fair for a reason. It is the whole Washington state's fair. And we know people will be coming, and whatever happens here in Pierce County will impact our neighboring counties as well as counties across the state.
Thank you, Dr. Chen. And we have Drew Mickelson, King 5.
Good afternoon. Thank you for making yourselves available. A question I have for Dr. Chen: why not include vaccinations as a condition of entry, or at least for the employees? It's happening at the schools. It's happening at healthcare facilities. Was that something that we talked about as a possibility, which obviously is a higher level than just masks?
Right. I think you're absolutely correct that it would be safer if, I think, we have already seen, like restaurants and bars going to, requiring customers to be vaccinated before they're let in. I think everyone's recognizing we're in a very difficult situation here. Part of this is, this fifth surge really crept up on us in a very surprisingly rapid way. And so there's some, this was one of the strategies we talked about. However, there are some logistics, which is, if we're, I think you asked about whether we should require vaccination of the staff. There just wasn't time. I mean, when you think about if you're taking the 2-dose vaccine, that's about 6 weeks between starting the vaccine and being fully protected. So it just logistically was not going to work here. I think that, as we move forward, we will be paying attention to other large gatherings. I think, everyone's very aware the Seahawks and the Mariners and the Rainiers are playing. So we need to be thinking about, in those situations, which are smaller events, but then they are large events, but just compared to the fair, they're smaller. That we need to be taking precautions such as considering moving towards requiring only vaccinated people attend those. So you're absolutely right. There are things that we can do now, which are wearing a mask, keeping the physical distance, not gathering large groups, all the things that everyone is familiar with. We also want people to test if they have symptoms or they might be coming in contact, and we want people to be vaccinated. Vaccination is more of a middle, longer term strategy. You can see that we're working with the fair, we're implementing all three of these strategies. But then there are certain things that we just couldn't do on a practical basis in the time frame we have.
Thank you again, Dr. Chen. And we have Keith Eldridge with Como News.
Thanks for taking the question. This question is for Kent. With regard to the first question that was asked on enforcement, if someone absolutely refuses to put on a mask and is a repeat offender, are you going to ask them to leave and escort them off the property? And are you concerned that there are going to be arguments amongst just the fair goers, those with masks and those without?
Yes, we are concerned there could be confrontations, that there could be arguments. If we find somebody who just simply refuses and has become, shall we say, a repeat offender, we're probably, obviously we're going to take those one case at a time, but there will come a time when we'll just have to ask them to leave. We think that a huge part of this is going to be education and communication. So in the next several days before Friday, we will expend a lot of time and energy making those who are planning on attending the fair aware that you will have to wear a mask. It's not an option. So we're going to really spend some time prior to folks getting here and at the gates too, letting them know that this is not an option, that you do have to wear a mask.
Thank you, Ken. Appreciate that. And just if I could follow on that, that's part of the reason we have everybody here today, to get the word out as much as possible. That's what we want to do ahead of time. And we have time for one more question, I believe, and we're going to have Jennifer Lee, it looks like, has her hand up, and that'll be our final question. Thanks, folks.
Hi, Kenny, and hello, everyone. Thank you so much for making time to take questions. I have a question related to the Hospital Association yesterday saying it's a bad idea to go to the fair, and just listening in on this meeting, it seems like many of you are saying that it's safe and that families should be excited to attend. For families who have heard, both sides of this, who are left confused, is there a, member of this panel who could provide some clarity between those very opposite evaluations? And as a follow-up question to the potential for the state fair to close, when would those evaluations be made? Is that on a daily basis or a weekly basis?
So let me take that question, Jennifer. I think you're absolutely right. There's a lot of concern about this. I mean, this is a huge event. It goes on for 3 weeks. It's as I mentioned earlier, a normal year, I think a million people come through that. This year. It might be, I think the fair estimates maybe 800,000. So a lot of concern. And we have worked through this, and we, as you said, I mean, we will be monitoring this carefully. It's going to, the fair is going to start with testing their employees. We're going to be monitoring that process. So just to repeat, the three areas, the three criteria that we're going to be looking at is going to be hospital capacity and what their crisis status is in Pierce County. And then the second is, what's the rate of positive results among fair staff, and the last is whether we're seeing any outbreaks in staff and or attendees to the fair. So, as I said before, we're committed to the health and safety of all people who live, work, and visit Pierce County, and we're taking this seriously, and we'll just move forward. And if we need to, then we change the direction that we're going in. But as you point out, the important thing is for us to monitor the conditions. We're not going to wait weeks and weeks for this. We're monitoring the information as it comes in.
Jennifer, Bruce Dameyer, just really quickly, one of the things is we did have our local healthcare systems, both multi-care and Virginia Mason Franciscan were involved in some of our early meetings. There are some protocols that were specifically put in place to reduce the impact on our emergency departments in our local hospitals. We're also having some further discussions on statewide policies that could be implemented to reduce kind of the burden on our hospitals. But let's be clear, if a family is nervous, they probably shouldn't come to the fair. But I think there's a lot of families that have been to the fair, will look forward to coming, even though they'll be masked, look forward to coming and getting back a little of that traditional fall they're used to. So we don't want anybody to come who's not comfortable being here. They shouldn't do something they think puts themselves at risk. But there's a lot of folks in our community and our state that I think are really looking forward to this, want to do it safely. And I think the protocols that we have in place are the best things we can do to ensure that great fair experience. Thank you.
Thank you, Executive Dameyer. It looks like, oh, Kent, did you have something to add to that?
Yeah, I want to echo Executive Dameyer's comments and say, you know, in a normal year, I would never say this. In a normal year, we want everybody to come and enjoy the fair. It's why we do it. We're Washington's place to come and celebrate. But this is not a normal year, and Executive Dameyer is absolutely correct. We want people who come to the fair to feel comfortable. We want them to feel safe. And if this isn't the year for that, hey, we understand. We understand, and we'll look forward to seeing you next year when hopefully this will be a return to normalcy. So that's really the way we feel about it.
Excellent. Thank you, sir. Thank you, Dr. Chen, before that as well. And that's pretty much all the time we have. I just want to point out again, it was great getting all these people together to talk about this, how we've worked together for so long to make this happen. If you have any follow-up questions, my email was on the list that went out for this press release. Email me. We'll try and get answers to those. Appreciate everyone for being here once again. Did any of our honored guests who spoke today have anything else they want to say before we leave? All right.
Kenny, the only thing that I would just add, you know, the fair has been, and the city of Puyallup have been key partners in the health department and the county's efforts to battle COVID in Pierce County. Boy, the number of times the city of Puyallup and at the fair's Blue Lot, we've had numerous testing sites and then number of mass vaccination events out there. So they have been key partners far before we got here today. So I just wanted to make sure that the broader community knows how key they have been in getting us to where we are today. And we all appreciate that. So thank you, Kent. Thank you, Mayor Dorr.
Thank you, sir, for those comments as well. And everyone who joined us, appreciate it. Again, let me know if you have follow-up questions. Thanks again for coming. I think that wraps us up.